Did you know that there are different kinds of prolapse? It depends on what organ is pushing through the vaginal walls. Hi everyone, this is Dr. Nabila Noor. I'm a fellowship trained and board certified urogynecologist and pelvic reconstructive surgeon, and welcome back to the channel. And today we're going to be discussing about different types of pelvic organ prolapse. Now, I always tell patients that the vagina is like a cylinder, right? So think of this cylinder as the vagina. So what that means is on top of the vagina, which is the anterior wall, we have the bladder. On the back of the vagina, which is the posterior wall, we have the rectum. And then apex of the vagina, that's where we have the uterus or the cervix. And for somebody who has already had a hysterectomy, that's what we call the vaginal apex or the vault, okay? And the different kinds of prolapse depends on what organ is pushing through this vaginal wall and protruding outside. For example, if the bladder is pushing down into the vagina, that's known as a cystocele or an anterior wall prolapse. On the other hand, if the rectum in the bottom is pushing through the vagina, that's known as a rectocele or a posterior wall prolapse. If it's the uterus, the cervix, or the vaginal apex that's pushing down, that's known as apical prolapse. And then sometimes we also have something called enterocele. We usually see it on women who have already had a hysterectomy, where the small intestine is pushing through. So as you can see, depending on which organ is pushing through the vaginal wall, there are different kinds of prolapses. The important thing to remember is that what's actually coming out is not the organ itself. It's the vaginal wall with the organ being on the other side. Oftentimes we say that the bladder is dropping. It's not that the bladder is coming out through the vagina, but it is pushing into the vaginal wall and causing the vaginal wall to balloon out. Same thing can happen with the rectum. It's not that the rectum is coming out through the vagina, it's the vaginal wall that's coming out because the rectum is pushing into it. And it's important to understand that because oftentimes I'll have patients come into my office and they're petrified of touching the bulge that they feel is the prolapse because they're worried that's actually their bladder or the rectum. That's not how it works. There's no hole in the vaginal wall because those organs are still inside your abdominal cavity, which is right in your belly. What's pushing through is the vaginal wall, and what patients see and what you see when you see something that's hanging out is really the vaginal walls, either on the top vagina, the back vagina. If there is an organ that's coming out, that's usually the tip of the uterus, something we called cervix. There are different ways we can stage prolapse. So stage 0 is no prolapse at all. Stage 4 is pretty much everything is just pushing all the way outside. And stage 2 is where things are right at the level of the vaginal opening to within a centimeter. So anything between stage 0 and stage 2 is considered stage 1 prolapse. Anything between stage 2 and stage 4 is considered stage 3 prolapse. Why is it important to know the stages? And also, why is it important to know what's prolapsing? Because that's what we as a urogynecologist use to determine what kind of treatment, especially surgery, is beneficial for the patients. And similarly with the stage of prolapse, right? For some women who may have very early stage prolapse, so stage 1, maybe even stage 2, conservative treatment is completely reasonable. Whereas for more advanced prolapse, whether it's stage 3 or 4, usually a surgical treatment is what's beneficial. Not saying that, if you have stage 2 prolapse, you can't consider surgery, but for the most part, that's kind of, an algorithm or kind of a metrics that we use to determine what treatment may be beneficial. I hope you found this video helpful, and as always, please subscribe and share, and I hope to see you soon. Bye.